Okay. Psychoanalysis versus other therapeutic strategies. The most famous one in Europe right now is cognitive behavioral therapy, which is actually a different school of thought from psychoanalysis. So psychoanalysis is actually depth psychology or imaginative psychology, as we call it. Cognitive behavioral therapy is behavioral psychology. So it focuses on targeted behavior. So B.F. Skinner, who was a very famous behavioral psychologist, actually taught many animals in his lab to, perform certain behaviors by giving them positive and negative reinforcement after every behavior. So mild electric shocks or small pieces of food he used, and he realized that any animal can be trained to do anything. And he basically used that as a theory to start this school of behavioral psychology, which was completely in contradiction with the psychoanalytic school of thought. So he believed that regardless of whatever traumas you have, whatever issues you have, you can be trained by a psychotherapist to change your maladaptive behaviors. And it was a rage at that time because it was very different to what people were used to with psychoanalysis. And out of it was born cognitive behavioral therapy, which is a very directed, time time effective way of changing behavior. So the differences are that psychoanalysis is more free, it's more subjective, meaning it depends more on the client, each client's particular case and particular individual trauma and particular individual repressed, aid. These are the sort of things that psychoanalysis deals with. It relies a lot on the patient's free association. Like I said, you could have hours of therapy where a patient doesn't say a word, and you actually just sit there and don't prompt them to speak. So it's very sort of loose in that way. There are no boundaries in how you can conduct psychoanalysis. uh, Whereas cognitive behavioral therapy is very targeted. So when you go into a cognitive behavioral therapeutic session, you are made to, within the first session, kind of formulate in your mind what are the problems in your life and which problems you want to work with, and the therapist kind of helps you to come to that realization. Psychoanalysis is very time consuming. Sometimes it can take years, 8, 9 years, to actually fulfill and start work, and for it to start showing some effect. But the effect of psychoanalysis is long lasting. So a lot of patients actually get completely cured from their neurosis. CBT, on the other hand, is very short term. It's very directed. So you don't go into CBT with 8 years of therapy. You go into CBT with, okay, the maximum that a cognitive behavioral therapist would see you is for 16 sessions. After that, you would have to renew sessions as a new package. But it's 12 to 16 sessions that CBT does. And the effects are very quick and very effective, but they're very short term. So you could relapse easily eventually, because you're not, according to what a psychoanalyst would say, CBT doesn't really tap into the core problem. It's more like fixing the symptoms that you have, the maladaptive behaviors that you've acquired over the years. Psychoanalysis is more flexible when it comes to the analyst itself. Like if I'm a psychoanalyst, I can decide what sort of therapies, what diagnostic tools, what sort of strategies I want to use, case to case basis. So if I have a patient who's very verbal, I can let the patient talk. If a very non-verbal patient, I can let the patient be completely silent, or I can use some prompts, in form of sort of tests, psychodiagnostic tests like Rorschach and all. So it's very fluid that way. The therapist gets to decide how they want to treat each patient. In CBT, the treatment plan can be very limiting when it comes to the analyst, so to the therapist. So what happens is that in CBT, you kind of have these worksheets and you have proper models and maps that you can use, that the first session is going to be this, second session is going to be this, third session is going to be this, fourth session is going to be this. So it's kind of like, session by session, you almost have like a map that you can rely on. So if you as a therapist are not comfortable with the freestyle that is associated with psychoanalysis, then CBT is more effective, because you actually have session to session guidelines. Whereas with psychoanalysis, it could take you 5 sessions to just get the patient to talk, and that's fine. You don't have to rush. When it comes to psychoanalysis, you can go at your own pace. Whereas with CBT, it's very, very directed. So it all depends on the therapist and the patient, what they're comfortable with. A lot of people I know say CBT was very effective for them. A lot of people I know say CBT didn't help them at all. And then they eventually went to a psychoanalyst, and then they could actually go to the core of their problem. So what I would recommend is, if people are going into therapy, I always tell them, try one or two therapists with two different, three different strategies, and see which strategy works for you. Some therapists who are psychoanalysts are better fit for some patients, and some therapists who are CBTs, they are better fit for some patients. So a patient has to feel, or a client has to feel, what they are more comfortable with and what they think is more effective in their case. That is why before you actually see therapy working, I know a lot of people for whom therapy has worked successfully, and they've actually changed therapists 3-4 times before they actually found the right therapist. So the therapist client fit is also very important in this case. So psychoanalysis works for some, CBT works for others. And finally, all treatment strategies overlap. So I use, sometimes I use CBT, sometimes I use psychoanalysis. In Europe, if you are a if you are a cognitive therapist, you would only mostly do cognitive behavioral therapy, or if you're a psychoanalyst, you would only do psychoanalysis. But in India, it's kind of fluid. It's like I've seen psychologists using both, overlapping. Even in Europe, I mean, there's no fixed sort of, many times therapists tend to use strategies from the other school of thought as well. If they feel that this patient is not responding well to this, they tend to change gears a little bit. So there's a huge gray area about, what you can do as a therapist. But training for being a psychoanalyst is completely different, and training for being a CBT specialist is completely different. And yeah, that's how it's the other therapeutic strategies in psychoanalysis is different to each other.